Sometimes our bodies whisper before our minds speak up. Sleep is one of those quiet messengers. The way you sleep, how often you wake, the kind of dreams you have, even how rested you feel when you wake in the morning, these are gentle clues about what's going on inside your brain. Over the years, researchers have found that certain sleep patterns can show up long before memory problems become obvious. That doesn't mean every sleepless night is a red flag, but when changes build up and stick around, they're worth paying attention to, because noticing them early gives you options. One of the most important things to understand is that not all sleep is the same. There are deeper stages of sleep that act like a nightly cleaning service for the brain, helping to clear away waste products that can accumulate during the day. When those deep stages shrink or become disrupted, the brain's ability to clear itself diminishes. You might not be able to see this directly, but you may notice the result: waking up still tired, feeling foggy in the morning, or finding that your usual mental sharpness is a little dulled. If those feelings start to happen more often, or if they don't go away after a normal period of stress or illness, it can be a signal that your sleep is no longer giving your brain the restorative support it needs. Another pattern to watch for is fragmented sleep. Everyone wakes briefly sometimes, but waking several times a night and having trouble drifting back to sleep is different. Frequent awakenings can be a sign that the brain's internal clock, the circadian rhythm that helps regulate sleep and wakefulness, is becoming less stable. When that clock blurs, days and nights can feel mixed up. You may find yourself napping more during the day, or feeling alert at unusual hours. That shift in rhythm can affect mood, energy, and memory over time. Dreams and nighttime behaviors also tell a story. A change in the vividness or intensity of dreams, or new movements during sleep such as talking, flailing, or reaching out, can sometimes be linked to changes in the brain regions that handle dreaming and emotion. In some cases, these kinds of changes appear years before other symptoms. That's why family members or partners who notice a sudden difference in how someone sleeps can be invaluable observers. Breathing during sleep matters, too. Conditions like sleep apnea, where breathing briefly stops or becomes shallow, reduce oxygen levels and fragment sleep repeatedly through the night. Untreated sleep apnea is associated with a higher risk of cognitive problems. If you or a partner notice loud snoring, choking sounds, or gasping during sleep, or if daytime sleepiness is increasing despite a full night in bed, it's important to mention this to your doctor. Simple tests and treatments can make a big difference for sleep quality and overall brain health. Restless legs and frequent need to get up to use the bathroom can also break sleep into pieces. While these problems are common as we age and often have treatable causes, repeated nighttime disturbances that leave you unrefreshed in the morning are worth tracking. It helps to think in terms of patterns over weeks and months rather than isolated nights. A single bad night after a stressful day, a trip, or medication changes usually isn't meaningful on its own. What matters is persistent change, nights that are consistently fragmented, mornings that are persistently groggy, or daytime energy that is steadily drifting lower. Keeping a simple sleep diary for a few weeks can be very revealing. Note roughly when you go to bed, how long it takes to fall asleep, how many times you wake, how rested you feel in the morning, and any daytime naps. If you prefer technology, many people find gentle wearable devices helpful for spotting trends, though they aren't perfect and don't replace professional assessment. Sharing these observations with your doctor can paint a clearer picture and help guide further steps, which might include evaluations for sleep disorders, medication reviews, or cognitive screening if other signs are present. It's also important to remember that lifestyle and environment play a huge role in sleep quality. Light exposure, activity during the day, caffeine or alcohol in the evening, and the comfort of your bedroom all shape how well you rest. Sometimes small, sensible adjustments can restore more natural rhythms. Other times, a medical cause needs to be addressed. Either way, noticing changes early means you can act early, and that makes a difference. If you're noticing persistent shifts in your sleep, more frequent awakenings, deeper tiredness in the morning, more daytime napping, new dream behaviors, louder or interrupted breathing, or a steady decline in mental clarity alongside sleep changes, it's time to bring those observations gently to your doctor. Early conversations open up options for testing and for steps that can help protect your sleep and your thinking. Next, I'll walk you through practical, gentle steps you can try tonight and over the coming weeks to improve sleep quality, reduce risky patterns, and support your brain's nightly restoration. You already know a little about what to look for: less deep sleep, more awakenings, daytime drowsiness, vivid dreams, or new movements at night, or breathing that stops and starts. Now let's talk about practical, gentle steps you can start tonight and keep doing over the coming weeks to support healthier sleep and protect your brain. These are things you can try at your own pace, and most of them are low risk but can make a real difference when they become steady habits. Start with light and routine. Our internal clock responds strongly to bright light in the morning, which helps reset the day-night rhythm. Try to get some natural light soon after waking, even a short walk outside or sitting by a sunny window for 10 to 20 minutes. That morning cue helps your body know when daytime begins and when night should follow, which supports stronger, more consolidated sleep at the right hours. In the evening, dim lights and avoid screens with bright blue light for an hour before bed. That helps your brain switch into sleep mode more naturally. These adjustments are simple but can steadily improve sleep timing and quality. Alzheimer's Association (CDC). Look at activity and exercise next. Gentle aerobic activity like walking, light cycling, or water exercise during the day often improves sleep depth at night and supports brain health over the long term. Strength and balance exercises matter too. They protect independence and reduce fall risk while helping your sleep. Try to finish moderate exercise at least a few hours before bedtime so the body can wind down, and aim for consistency. Regular movement across most days of the week has the biggest payoff. If you have medical concerns, a quick check with your doctor before starting a new program is wise. National Institute on Aging. Pay attention to evening habits that sneakily fragment sleep. Caffeine, even early afternoon coffee, can linger and reduce deep sleep for some people. Alcohol might help you fall asleep, but it fragments the deeper stages later in the night. Large evening meals or too much liquid close to bedtime can bring you to the bathroom more often. Try shifting caffeine earlier, limiting alcohol near bedtime, and timing fluids so late-night trips are less likely. Small adjustments here often improve how restorative your sleep feels. Alzheimer's Association. Make your bedroom work for sleep. Keep it cool, quiet, and as dark as you can. Earplugs, a white noise machine, or heavy curtains can help if noise or street light is a problem. A comfortable mattress and pillow that supports your usual sleeping position are worth considering. Discomfort leads to tossing and waking. Treat the bedroom gently. Reserve it primarily for sleep and restful intimacy rather than a daytime activity center. These environmental fixes are low cost and frequently produce noticeable change. Mayo Clinic. If you wake at night and can't fall back asleep, use a calm strategy rather than worrying in bed. Get up, go to another dim room, do something quietly relaxing, read a few pages, do slow breathing, or practice progressive muscle relaxation, and return to bed when you feel sleepy again. Worrying about losing sleep in the moment only trains the brain to associate bed with stress. Over time, a consistent no-stress approach helps the bedroom become a place the brain expects rest from. Alzheimer's Association. Track patterns so you know what's ordinary and what isn't. A simple sleep diary for 2 to 4 weeks can be very revealing. Note bedtime, wake time, number of awakenings, naps, and how rested you feel in the morning. If you prefer tech, many gentle wearable devices can show trends in sleep stages and awakenings, although they aren't diagnostic. Bring your notes or summary to your doctor if you see persistent problems. Numbers and observations make it easier to decide what to do next. AASM. Ask about sleep apnea if you snore loudly, gasp, or wake choking, or if daytime sleepiness increases despite what seems like adequate time in bed. Sleep apnea reduces oxygen and fragments sleep repeatedly, and studies have linked it with markers associated with Alzheimer's. Simple screening and treatment, often with CPAP or oral devices, can restore more continuous sleep and improve daytime alertness. It's worth addressing because it's a treatable contributor to risk. Mayo Clinic News Network. Yale Medicine. Be cautious with sleep medicines and supplements. Many prescription sleep aids and some over-the-counter medications increase the risk of confusion, falls, and daytime drowsiness in older adults and are usually not recommended as long-term solutions. Melatonin may help with circadian timing for some people, but it's not a fix for chronic sleep fragmentation and can have interactions or side effects, especially in people with other medical conditions. Always review any new medication or supplement with your doctor or pharmacist to weigh benefits and risks. Alzheimer's Association. PMC. If restless legs, frequent nighttime urination, chronic pain, or medication side effects are interrupting sleep, these are problems with solutions. Treating a bladder issue, adjusting a medication that causes wakefulness, using proven therapies for restless legs, or addressing chronic pain can restore sleep continuity. That's why a medical review is often a helpful next step when simple sleep hygiene changes don't fully resolve the problem. Bringing your sleep diary and a list of current medications to an appointment helps the clinician see patterns quickly. Finally, there are specific signs that should prompt a more urgent conversation with a clinician, a steady decline in daytime thinking or memory that goes along with worsening sleep, new or dramatic changes in dream behaviors such as acting out dreams or violent movements, or loud choking/gasping breaths during the night. These can be clues that deserve further evaluation, possibly including a sleep study, polysomnography, or referral for cognitive screening. Early testing and treatment open up more options and help you and your family plan with clearer information. These steps, routine light exposure, regular gentle exercise, sensible evening habits, an optimized bedroom, careful review of medications and supplements, and timely medical follow-up, are practical ways to protect your sleep and support brain health. In the final part, we'll walk through what specific medical tests look like, what questions to ask your doctor, how families can help gather useful observations, and longer-term strategies to reduce risk and keep your nights as restorative as possible. When it's time to bring sleep concerns to a clinician, it helps to know what the common tests look like and what they can tell you. An overnight sleep study, often called polysomnography, is the most complete test. You spend the night in a sleep lab or accredited center while sensors record brain waves, how your eyes and legs move, your heart rhythm, breathing effort and airflow, oxygen levels, and body position. That detailed picture can reveal not only whether breathing stops at night, but how your sleep stages are arranged and how often sleep is fragmented, information that guides diagnosis and treatment. Sometimes your doctor may recommend a home sleep apnea test instead. These at-home tests focus mainly on breathing and oxygen and are useful when obstructive sleep apnea is the main concern. They're less comprehensive than an in-lab study and don't record brain waves or full sleep stages, but they're simpler and more comfortable for many people. For monitoring sleep patterns over many nights, actigraphy, wearable movement trackers, can provide helpful trend data about total sleep time and nighttime awakenings, although they're not a substitute for a formal sleep study when a detailed diagnosis is needed. If sleep testing raises questions about thinking or memory, clinicians often start with brief cognitive screening tools. Two common tests you might hear about are the Montreal Cognitive Assessment, or MoCA, and the Mini Mental State Examination, or MMSE. Both are short, roughly 10-minute checks that give a snapshot of attention, memory, language, and problem solving. MoCA tends to be more sensitive for milder problems, while MMSE is shorter and widely known. These screens don't diagnose Alzheimer's on their own, but they can point to whether more detailed neuropsychological testing or brain imaging is warranted. One of the clearest medical connections we understand is between obstructive sleep apnea and cognitive decline. Repeated drops in oxygen and night-after-night sleep fragmentation can contribute to brain changes and raise the risk of developing mild cognitive impairment or dementia over time. The good news is that when sleep apnea is treated, commonly with continuous positive airway pressure, or CPAP, there is evidence that cognitive symptoms can stabilize or even improve in some people. That's why screening for sleep-disordered breathing and following through with treatment when indicated is a meaningful step for brain health. Before a visit, prepare a concise picture to share. Bring a short sleep diary or a summary from a wearable showing sleep times and awakenings. Note the frequency and timing of naps. List any loud snoring, gasping, or witnessed pauses in breathing. And write down medications including over-the-counter sleep aids, supplements, and alcohol use. Family members or partners can be incredibly helpful by describing observed behaviors at night, acting out dreams, unusual movements, or prolonged confusion on waking, and by noting subtle daytime changes such as increased forgetfulness, slowed thinking, or shifts in mood and motivation. Video recordings of nighttime behavior can be especially useful for clinicians evaluating unusual dream enactment or sudden movements during sleep. When testing is recommended, ask a few practical questions so you know what to expect, what type of test they suggest and why, whether it will be done at a clinic or at home, how to prepare, medication changes, caffeine or alcohol restrictions, how results will be shared, and what the next steps could be if the test is abnormal. If sleep apnea is found, ask about CPAP options, mask fitting, and support for getting used to therapy. If another sleep disorder is suspected, ask about referral to a sleep specialist or a neurologist. For cognitive concerns, ask whether a full neuropsychological evaluation or brain imaging might be useful and how follow-up will look. Clinicians appreciate clear, specific observations, and those details help them match the right test to your needs. Beyond tests and treatments, long-term strategies that support both sleep and brain health are important. Controlling vascular risk factors, blood pressure, blood sugar, and cholesterol, staying physically active with regular aerobic and balance strengthening movement, maintaining social connections and mental engagement, treating hearing or vision problems, and following a balanced diet that favors vegetables, whole grains, healthy fats, and lean proteins are all pieces of the same puzzle. Good sleep habits and treating sleep disorders when they're present are central parts of that approach because sleep plays a role in clearing brain waste and supporting memory consolidation. While no single change guarantees prevention, combining sensible lifestyle steps gives your brain the best chance to stay resilient. Finally, remember that acting early and working with trusted clinicians gives you options. If testing finds a problem, many treatments and supports can improve sleep, reduce symptoms, and help you and your family plan and adapt. If testing is reassuring, the information still offers a baseline and guidance for keeping healthy habits. You don't have to solve everything at once. Small, steady changes, clear communication with your care team, and the caring observations of family can all make a meaningful difference in preserving the quality of your nights and the clarity of your days.